Hi, I'm Dr. Kristen Capan, and today we're going to talk about estradiol levels. So, I see patients in the clinic a lot for perimenopause and menopause. And one of the first things we do is check hormone labs. And women always ask me, like, what is normal or what should my numbers be? And this is a loaded question. So, today I'm going to go over what these levels are, what they look like, why they vary depending on where you are in life and your, let's say, menstrual state. And if you are entertaining or are on hormone replacement, what that looks like as well. So here we go in terms of my slides here. So an overview of this is the most important thing we need to know is that estrogen changes throughout the menstrual cycle. Okay. So when we start menstruating and having that first period, our estrogen levels go up and down throughout the month. And these levels get as high as on the Canadian levels, let's say up to 2000 or 400 on American units. And it goes up and down, up and down, up and down. During perimenopause, these levels go absolutely wonky. Okay, sometimes you can have super high levels, sometimes you can have levels of zero. The body is in this state of flux of no man's land or no woman's land, where we really don't know what's happening. And then when menopause hits, and then that 1 year after menopause, estrogen levels completely decline, often to the level of zero. And women will come in and be like, I have zero estrogen levels. I'm like, yes, because you are in menopause, okay? You're in that post-menopause state. So things change depending on where you are. So if you're a menstruating female versus in perimenopause versus in menopause, these levels are going to look completely different. Symptoms of estrogen changes have many different influences, and we'll go over a few of these. The most common that we just talked about is age. So a 13-year-old is going to have way different levels than a 65-year-old that's not on any type of replacement. Other things that affect it in term are progesterone balance, or if somebody's on progesterone, stress, how much sleep you're getting, body composition, inflammation, insulin resistance, thyroid health. So often hypothyroidism has impact on this, as well as metabolic function. So what does estradiol levels actually tell us? So on the medical side, if someone were to come into the clinic and they are having some kind of, if you want to say hormone issue, or some kind of health concern, where we send somebody for labs, one of the hormones we check for is estradiol or E2, which is one of the three estrogens, but also the major estrogen produced by the ovary. So since it's produced by the ovary, the estradiol level tells us what the ovarian function is like. If the ovaries are working, those estradiol levels are going to be present versus somebody that's postmenopausal. The ovaries are, let's say, retired, though they're no longer working. So those estradiol levels will naturally be zero. Okay. So it's a good indicator of ovarian function. It's also an indicator of menstrual cycle activity. So during our menstrual cycle, its estrogen levels are going to rise and then they're going to fall, and then they rise and then they fall. So that has that cyclical activity. And depending where you are in your cycle, that estrogen level is going to vary. The other thing it helps with is fertility status. So if somebody is fertile, they're going to have more hormones than, say, somebody that's postmenopausal, where again, those ovaries have retired. They're no longer releasing an egg to become fertilized. So we know that, fertility at the time of menopause is not going to happen. And versus somebody that's, say, in their 20s or 30s and they're having trouble starting a family, this will give us a little bit more indication as to why. The estradiol levels during perimenopause are absolutely wonky. Okay. We really don't know what is happening during this time. So we can check levels, but it's not going to give us a great indication of what's happening, because during perimenopause, you can have levels of zero of estradiol, And then you can also have levels in the hundreds or even thousands, depending on if it's US or Canadian values. Okay. So all perimenopause tells us is that the body is in an extreme state of flux. And then when we get to the menopause transition into postmenopause, this is where the estradiol levels start to decline and become usually undetectable or close to zero. Okay. Estradiol levels also correlate with hormone symptoms. So if somebody is having really bad hot flashes, the mood swings have started, there's sleep disruption, and vaginal dryness, this usually tells us there's not enough estrogen. And then for those that are on hormone replacement therapy, estradiol levels are one thing we can check to make sure that there's response to it. So one, to make sure that the body is actually absorbing it. And then to see if we need to change that dosing. So this is, let's say, more of an art, and there's different um, ways that we can treat in terms of hormone replacement. There's some physicians that will treat solely on symptoms. There's some that will treat depending on numbers. And then there's people like me that kind of do a little bit of both. Okay. And this is where I find the art comes in. So the art of hormone replacement, where you're really looking at the whole picture. You're looking at the woman in front of you, what they're going through, what their medical history looks like, what their symptoms are like, and what they're looking for. Some people have zero symptoms at all and want to be on hormone replacement because they've heard of or know the benefits of it. Versus some people are so symptomatic, they just can't get on with their life unless they help start treating these symptoms of menopause. So estradiol levels naturally fluctuate. Okay. So we know they go up and down during the menstrual cycle. We know they go absolutely wonky during perimenopause. We know they change with age, and we know that they decline in menopause. And we also know that any type of stress, whether it's physical, emotional, psychosocial, anything that the body's going to that's incredibly stressful or that might increase cortisol levels, burns through hormones. Okay. It's just like if you put a full tank of gas in your car and then literally floored it, like pedal to the metal type thing, and just kept driving full speed. You're going to burn through that gas way faster than if you were just going slow and steady and not stopping, right? So stress is going to burn through hormones. And so people that are in a chronically stressed or chronically inflamed state, or might be dealing with any type of autoimmune disorder, they may need higher amounts of hormones to replace it, or see more of that fluctuation that than somebody that's in not as stressed of a state. Body fat percentage also is an indication, or will change or fluctuate. Okay. Somebody that has significant amount of body fat, that fat becomes hormone producing and will produce the one estrogen called estrone. Okay. And then these levels of estrogen, or so-called bad estrogen, are going to be higher in somebody that's morbidly obese versus somebody that's really, really thin with minimal body fat. Okay, so people that say are weightlifters or fitness competitors, they may actually need more estrogen because they don't have much reserve compared to somebody that has more moderate body fat percentage. Illness is another thing. So just like stress, illness puts our body through stress. So when we're sick, we may need more hormone than when we're not. Okay. And then certain medications, thyroid being one of them, that can affect the levels, progesterone as well. So if somebody's on progesterone, or say the progesterone levels are increased, that makes this little teeter-totter with the estrogen. So if you increase the progesterone levels, the estrogen levels are going to come down. So you don't want to make too many changes, or you find that you're just chasing it all the time. And then also with timing of medication. So if somebody's on estrogen replacement and takes their estrogen at the same time as other medications, or say supplements, it's going to have different absorption than when taken on an empty stomach by itself. Okay. And somebody that's on a topical, let's say a topical estrogen, like a gel or a cream, it's also going to fluctuate depending on when they're putting on time of day and location. Okay. Signs of estrogen deficiency. So if somebody is postmenopausal and the ovaries have stopped making estrogen, some women, not all, will start showing signs of estrogen deficiency, which also coincide with menopausal symptoms. Okay. Some women have zero symptoms whatsoever. Okay. But the majority of women that I see, if they have deficiency in estradiol, they'll come in complaining of urogenital atrophy. So the thinning of the vaginal tissue and the labia on the outside can be uncomfortable just with walking, like literally feeling like they're walking with sandpaper between their legs. Okay. Incontinence, both urinary as well as fecal incontinence, because estrogen does help with that, the skin as well as the pelvic floor muscles to keep everything in place. The sagging skin and sagging breasts, because estrogen does help plump up our tissue. And then same thing with the increased skin wrinkles. Estradiol deficiency also results in fatigue, depression, mood swings, insomnia, or not being able to stay asleep, especially in the middle of the night. And then the decreased libido, secondary usually to vaginal atrophy and dryness. In terms of health and wellness, so we just talked about symptoms in terms of menopause. Okay. So if you have those low levels of estrogen, you can replace it with estrogen to help get rid of those symptoms. Well, some women understand the benefits of estrogen replacement outside of symptom management. And this is where I said at the beginning, there's people that are physicians that manage hormones based on symptoms. And there's also ones that manage hormones based on levels. And this is where we get more into the health and wellness of things. So estradiol is of utmost importance in the health and wellness aspect because it can actually reduce our risk of heart disease, specifically for women, can reduce our risk of strokes. It can reduce our risk of colon cancer. It can help reduce and sometimes actually treat osteoporosis and osteopenia, reduces our risk of urinary tract infections, reduces our risk of Alzheimer's disease and dementia, reduces our risk of macular degeneration, and reduces our risk of cataracts. So if you look at all these, like when you see this, like why wouldn't you want to be on estrogen replacement? And this is often that discussion I have, like somebody that comes into the office, they're very resistant, being, I want help, but I don't want to take hormones because hormones are dangerous and they're going to kill me. But when you actually look at the benefits, it's like, well, what we've been taught and shown over the years, it may not actually be true. So I do have women that will come in and be like, I'm completely asymptomatic. I've seen and read about all the benefits there are, and I want to be on estrogen replacement for the health aspect of it. Now, we're going to talk a little bit about ranges of estradiol. So when I send someone to the lab, or say someone has gone to their family doctor having symptoms, they'll send them for blood work. And when you look at the labs when they come back, the estradiol level falls in that normal range. Okay. And the family doctor or practitioner says, look, you're normal. There's nothing wrong with you. Your labs are fine. Go home. Like nothing's happening hormonally here. Okay. So there's a huge range of what normal actually means. So this is one of my personal pet peeves because normal doesn't actually mean that you're normal, right? And we can really improve somebody's quality of life with treatment of hormones. So this is where normal is not always optimal, okay? And we look at this and discuss this in office. Now, my other pet peeve is when women have their labs done and they're on birth control pills. Well, the whole purpose of birth control pills is to not get pregnant, is to provide birth control and not have a egg released from the ovary. So if birth control pills are working properly and somebody's taking them regularly and properly, they're going to actually inhibit or stop the natural production of estrogen and progesterone in the body. So when you are on birth control pills and you go get your labs checked for hormones, your estrogen levels are going to be zero, which means, again, the birth control pills are working. So it's not that you're in menopause, it's you're actually taking a medication that's stopping the natural production of estrogen. Okay. So this is very important because it's a question I often get asked when somebody's in perimenopause and they're like, I want my hormones checked. Then you ask, they're on birth control pills. So it actually tells us absolutely nothing. Okay. If somebody has been on birth control pills and they're not having a period and they want to know if they're in menopause, really the only way of knowing is having them go off of it for at least 3 months. Okay. So this is the time that's needed for the washout period. Once the hormones are out of the body, then at 3 months off of the birth control pills, we can check the estrogen and progesterone levels as well as the LH and FSH. And this will give us some idea of menopause status. Also, if they start bleeding again, we definitely know they're not in menopause. Okay. Um, the other things with lab ranges is they're based on population averages. Okay. So a person that's 13 years old is going to be in the same category as somebody that's 55 years old. Okay. Their levels can be completely different. Also, one person the exact same age may have very different normal levels compared to the one of their colleagues that's the same age. So these levels are so variable and it doesn't necessarily show what optimal health is. Okay. And some women may have symptoms with really high levels of estrogen, and some women will have no symptoms with really low levels. So everyone is so different and unique when it comes to this. Estradiol levels also vary depending on age. So naturally, as we get older, levels will decrease. Okay. And we talked about earlier about stress, lack of sleep, and then the body composition. So again, if fat mass and really has that variability in terms of estradiol levels. Okay. If we check estradiol levels during perimenopause, so that 10 years or so leading up to menopause, on average, say somewhere between 40 and 50 years old, these levels are actually meaningless. They don't tell us anything unless somebody is in menopause and their periods have stopped because they vary. You literally can check estrogen levels on a perimenopausal woman today and check them again a week later, and they're going to be completely different. Okay. So we really don't know what the body is doing. Like it's in this complete state of havoc during perimenopause. So checking the levels, again, it's meaningless or it's not really going to help in terms of treatment at this time. Okay. A normal lab also does not always mean you feel normal. So I've had women that are on hormone replacement and their labs are in that, let's say, ideal range, and they're still suffering. They're still having hot flashes. They're still having vaginal dryness. They're still not sleeping. Okay. That for them, that's not normal. So everyone is unique and may need different optimization. So let's look beyond the numbers. Why looking at the whole picture matters instead of one isolated number, why symptoms matter just as much as lab numbers. Hormones are only one piece of the picture. Okay. And then again, sleep, stress, cortisol, thyroid, nutrition, insulin, inflammation, they all interact together. Optimal health requires looking at the symptoms, the labs, the lifestyle, and long-term goals collectively. So it's everything. We don't want to look just at estrogen levels. We want to look at the whole person. We want to see what's happening in their life, and where best we can treat them. Education definitely creates empowerment and informed decision making. So, like those women that come into office requesting estrogen replacement versus someone that's coming in symptomatically, they're two very different groups of women. And then understanding physiology also helps remove guilt and self blame. So, a lot of women during this transition hold themselves guilty. Like, what am I doing or not doing? Why is this happening? Questioning and blaming themselves for how they feel or act during this. Okay. So if we understand what's happening with our bodies and these huge fluctuations, it definitely can help us understand and how to get through this a lot easier. And then also know what's out there so that we don't have to suffer. In terms of estrogen levels through the menopause transition, so perimenopause often causes hormone fluctuations before those levels start declining. Levels can swing very high and very low, and they're very unpredictable. Again, this is that state of crazy havoc, like no woman's land. Okay. And then when we get to menopause, it's traditionally defined as no bleeding, so no periods for at least 12 months. And then we also see that gradual decline in estrogen level because the ovaries are now retired. They have stopped working. And so when we check estradiol levels, usually 12 months after that last menstrual period, they'll start being closer to zero or actually undetectable. Okay. Now, in terms of perimenopause, symptoms may begin years before menopause officially occurs. So if menopause on average is at age 51, if you're looking at 10 years prior to that, age 41, and then, I do see some women that have gone through full menopause in their late 30s. So this is where some women may start with perimenopausal symptoms in their late 20s. Okay, so and this is often, if you ask family history, it's often similar, right? If moms go through menopause earlier, chances are daughters will too. But always keep that in the back of your mind. So if you're younger and really suffering from hormone changes, it really could be that early onset of perimenopause, and really, advocate for yourself in terms of treatment. And last slide here is, where are these actual target numbers? So these are this is more scientific, okay? So if you are having symptoms, we can treat until those symptoms go away. Once you're on hormone replacement or estrogen replacement, we can check estradiol levels to make sure, again, it's working properly, it's getting absorbed, making sure the symptoms are going away. And then if we want to go next level, we can treat to optimal levels. So this is where you're going to get the greatest health benefit. Okay. So treat initially to symptoms, check levels, and then make sure you're somewhere in this optimal range. Now, I will share with you, it's really challenging to get women to these optimal ranges, because the higher the estrogen levels are, sometimes the more symptomatic women are. So the most common symptoms are going to be bleeding. So you're like, yay, I'm in menopause, I'm never going to have a period again. And then all of a sudden you're bleeding. Well, that's not what you signed up for, right? So it's important. We want to hit target in terms of levels, but we also don't want to reverse everything and get back into that puberty range again. So we want optimal levels where we're going to get the health benefits, but we don't want the side effects like bleeding or breast tenderness. Okay. So if we can get to these levels, great. If not, we just want to make sure, number one, that the symptoms are resolved or improved so we can have that quality of life. So on here, I have both the Canadian values and the US values. So on the Canadian side, we usually want to hit to that, let's say, minimal of 220, and on the US side to that minimal of 60. If we can get a little bit higher than that, great. And then just in comparison, because I often hear this as well, women will come in and be like, those levels are too high. Well, when you actually look at what their levels were when they're menstruating, it doesn't compare. Okay. So say if somebody's on estrogen replacement using the Canadian values of picograms per milliliter and their level's 250, well, when they were menstruating, their level might have been 2000. That's a really huge range. Okay. So the 220 versus 2000 of replacement versus what you've been like for most of your menstruating years, it just doesn't compare. So if there's that fear of, oh my goodness, I'm going to put estrogen into my body, it's still going to be nowhere near what your body or your ovaries were normally making at the time of menopause. So if you'd like to learn more, follow me, and we'll keep having these discussions. If you have any questions or any other content you'd like to hear about, please post below. Have a wonderful day.